I am not originally a person who will classify myself as into any specific component of services. I have been working in many different aspects of computer science, but then when one of my good friends, Sumi, approached me that he wants me to give a keynote talk here at this conference, I started thinking about uh, what can I discuss and what can I really share with people about services. So I'm hoping to see Sumi so that he can correct you if I'm not representing him correctly. So let's give him a minute while he comes in here. So as I started mentioning that when Sumi approached me to give a keynote talk at this particular conference, I debated a little bit whether I want to accept it or not. And there were two reasons. One was very personal, which I may mention in a minute. But the second reason was that I thought, what will Sumi want me to say here at this conference? Okay? So I looked at your website, and when I looked at the website, it said, services covers all aspects of services, computing and applications, current or emerging. So let's focus on emerging aspects. And I asked Sumi, what does he expect me to do? He said he wants me to tell something to people that will make everybody very rich and famous. Okay? And Sumi started talking about developing the next killer app. Okay? Now just think about this. I am working in health area. Okay? And Sumi is asking me to develop a killer app. Okay. Does it even make a sense that I develop a killer app? So I started telling him that we need really a quiet guardian. And this will be providing a lifeline at every moment for everybody in every society. That's what I want to discuss with you, that how can we do this? Now, when we start doing this, the important thing is, how do we make a case for this, or how do we start thinking about this problem? Okay. So I'm going to divide my talk not in completely separate areas, but overlapping areas where in the beginning, well, people are still coming in. So I will first talk about what is the real challenge, because I would like to say, with apologies to one of my friends who came to attend the talk here from healthcare area, that I will argue that healthcare is broken. And if healthcare is broken, what can we do? So I will argue that we have the correct time to make some big changes. And these changes are going to come from services, from technology. And then we'll discuss how do we do some of these things. So you will start thinking, why am I going to tell this story? Yes, as you heard possibly in introduction, uh, I have been working much of my life in tech. I worked on different aspects of tech. But does that make me qualified to talk about healthcare? I'm not from healthcare area. I'm not a healthcare provider. I'm not a doctor. So what gives me right to talk about healthcare? I'm going to argue that I'm very well qualified because for the last 45 years, I have been a big recipient of healthcare. Exactly 43 years ago, in this part of the world, I first time saw what an intensive care unit is. I was put in a hospital for some time of all the places in Linköping in Sweden. And after that, I had many occasions, many opportunities, many chances there to see very closely how healthcare works, what is needed, and what technology can provide. And that's what forced me to start thinking about 10, 15 years ago, uh, literally about 15 years ago, to start thinking about what we can do about healthcare. So let me start by first mentioning a very simple thing that many of us in this room may know in slightly different form. Homeostasis. How many of the people in this room are familiar with homeostasis? Not too many people raise their hands. Homeostasis possibly is the best that you see in nature in terms of engineering effort. And this is a self-regulating process by which all biological systems deal with uncertainty, deal with any kind of problems all the time. And if you start analyzing this without going into too much detail, you find that every aspect of our body is dealing with homeostasis. And the most common example of that is given in terms of diabetes. How our body controls what we eat and how it regulates in our body, what will be the glucose level, and how we are going to deal with that. Okay? Can be considered that it's really one very simple thing, continuous measurement and self-correction. Norbert Wiener got inspiration from this process to develop cybernetics. When we talk about cyber physical system, we are really talking about homeostasis. And in this room, many of us talk about cyber physical systems. Okay? But more interestingly, all the AI developed from cyber systems. So when we start looking at this, we realize how important this has been. But when we look at the healthcare today, it appears that the term healthcare is a wrong term. The correct term should be sick care. Okay? We don't care for health. Our systems care for sick people. They care for diseases. Okay? And it is very clear that whether you look when your car breaks down, your computer breaks down, anything in your home breaks down, or your body breaks down, the process is exactly the same. You go, they collect all the data. After they have collected the data, they think, can they make a decision? If they can't make a decision, then they think, what else is needed? After collecting that information, somebody who could be a doctor, who could be a mechanic, or just a simple uh, person who knows a little bit about it, and they start thinking what could be going wrong, and then they come up with the prescription, which is nothing but their recommendation based on their knowledge of how to fix the problem and what is going on with you. So it's nothing but a recommendation engine. This is how all the things get fixed. And because of limited resources, though this is not the most optimal thing that you should go to a doctor only when you are sick, we had to follow this particular approach. When we start thinking about this, then you have to start thinking that what is the role that data plays. You saw that whenever anything happens and you go to a doctor or to a mechanic, they are collecting all the data. Okay? So what is the role of data? Particularly when you are thinking about health. When you start thinking about this, you find something very, very interesting. Data is the most important aspect which is used to fix your health. All other things that you hear about medicine and all those things, they are different mechanisms to implement your knowledge, your solutions to those things. Okay? So, when we start thinking about this, we find that there is a very, very interesting problem, very interesting situation. Okay? I call it healthcare system paradox. The paradox is, ask yourself, who is more important to you, your car or your child or you yourself? Okay? When you start thinking about this problem, it's very interesting. You collect about 219 terabytes of data every year about your car. And you collect about 1 megabyte of data every year for your child. So who is more important? If your child is more important, why don't you collect more data? Okay. And so much discrepancy in the data, it's mind-boggling that something like this is going on. Because when you start considering this, we collect more than 1,000 times data for our machines, not just the cars. Cars are the extreme example. But for our normal machines that are nowadays mostly electronically fixed and these things there, then for our kids or for ourselves. This is very interesting. But one thing we should remember is the data without a delivery mechanism is like a blocked artery. Yeah. And as we all know, this is one of the most serious problems. So how do we deal with this problem correctly? In terms of our body, it requires many systems continuously working together whenever there is a artery is being blocked or something like this. Same thing we do to all other systems, that we require a system of systems which you can call different types of services into care when you want to do. Let's look at how the health paradigms has developed. There are 4 different stages which are considered important. First was the pre-scientific approach, where we depended on the God, on faith, on evil spirits and all kind of things. So let's not worry about it. Then came the sick care that I mentioned to you, where we found that whenever breakdown happens, we are going to go and try to fix the problem. Next came the preventive approaches. Nowadays, and we are just coming out of the biggest preventive approach that we have ever seen, the pandemic, where the whole effort, the world was shut down because we wanted to prevent the spread of disease. Okay? So preventive approaches dominated that. The next approaches that are evolving are starting to be called aspirational approach. Okay? And we can compare all these 4 approaches, what goes on in those 4 approaches, which I will not discuss with you here, but just leave this table there to see. But what I want to do is to jump next to start thinking about the opportunity that we have. And how do we make the best out of this? The most important thing is, as I mentioned in the earlier part, I am here in front of you because of the advances in the healthcare, health sciences. Otherwise, I was told by my gastroesophageal cancer people that the probability that I will live beyond 5 years, and this was in 2004, is very low. and that I will lead normal life is also very low. 21 years after that, I'm standing in front of you and giving this talk. Okay? I do not have, in some capacity, the completely normal life, but very few of us at my age have the normal life. Okay? So this is all because of healthcare or health sciences. Now, how can we learn some important thing from healthcare sciences? But then, how do we align these values to what humans really want to do? And that's a very interesting and difficult problem. Why is that a difficult problem? Well, let's think about it a little bit. Let me ask you a question. When and where do people get best health care? What do you think? Any idea?
When they have money.
Say it again.
When they have money. Money.
What about this? When when they are about to die. Just think about this.
Yeah.
And then you are put in intensive care unit, and in intensive care unit, they are putting lots of sensors on you. They are measuring those things, displaying all those things. There are nurses and doctors available to make decisions at every moment. Okay. Does this remind you about cyber physical systems? Okay. Does this remind you about all the services that you have been talking at this conference? Okay. So what you see is that the best care you get there. And the reason that you get the best care there is very simple. Because what is going on is you are seeing that all the biometrics are being measured and monitored. There are one or more nurses take the required actions. There are experts available to make the right decision all the time. The question is, when you come out of ICU and go home, what happens? What happens to you? And that's where you start thinking that if the best care is in ICU, should we live all our lives in ICUs? As soon as the child is born, we put the child in the ICU, and the child remains in ICU till the child dies. Yeah. Sounds funny, isn't it? But is that really funny in this room? Not at all. That's what you guys have been doing. That's what you do services for. That's what you are doing, all these measurements continuously taking place. You have this, you have this, you have this, you have clouds and A's and IoTs and whatever you want to talk about. Your AI systems, yeah, and all those things are going on. So as your life is progressing, all these measurements are taking place. So effectively, if you think about it, the systems that we use today have more measurements, more ability to continuously monitor and decide what's going on than the nurses and doctors can do in the ICU. So this is not totally a ridiculous idea. Let's push this argument slightly more. In the current system, when you go to a doctor, what are you called? Patients. Why are you called patient? There are three important components of stakeholders in healthcare and one secondary component. The three important components are insurance companies, the doctors, healthcare providers, employers, Who is the ATM? You. Eh, You have to patiently wait till you become sick. Then you have to patiently wait till you can make an appointment with the doctors. Then you have to patiently wait when you go to doctors and they come up with the diagnosis. And then you have to patiently wait whether it works or not. And all these kind of things going on there. So you are very patient. So at least they have recognized that you are patient. You are not a person. You are a patient. Yes, you are a patient person. Can we change this? And can we make everything around you? And that's what we want to do. We want to put everything around you. In cloud, you are observing everything. All the knowledge related to health sciences is there. And we are putting all these things there so that we can start making all the important decisions. That means we go from crisis to all the time ear care. And that's what is this thing. This is what we want to do. And if we want to do this, that means we start calling it now personal care unit, or better still, personal care utility. This is an utility that exists in cloud, that continuously measuring, continuously doing all these things, and providing you help, providing you guidance at all the time in your life. That's what we are showing here. Yeah. One very important point that I want to make here, not only from the perspective of what I have been discussing, but from technical perspective also, because we will jump into the technical perspective. Oscar Wilde said about 150 years ago, society exists only as a mental concept. In the real world, there are only individuals. If you think about this, what he argued is ultimately each individual is the most important thing. In place of considering that you are part of a society, when I go to a doctor, what do they consider me? Because I live in California, that here is an Indian male in his 70s who had been a professor, who lives in Irvine, California. They consider many population, Indians, people living in Irvine, people in the 70s and all these things, and they consider that I am a statistical sample of all those classes. Are all Indians same? Are all 70-year-old people same? And all these things, so when you start considering it, you are not a statistical sample of any particular thing. You are an individual. Okay? If you have all the information about individuals, then you can form populations. And scientifically, mathematically, that will be much better approach to follow than considering you to be a sample of a population. Health sciences have very clearly recognized this fact, and that's why there is increasingly use of term, some of you may have heard it, it's called n equal to 1. When you always do the experiments, people say, how many people you experimented with? What was n equal to? And it was considered that higher the value of n, better off you are. But now people have started realizing that having longitudinal data about each individual is more important, and that's why n equals 1, than having data for 1 million people. Yeah. So how do we deal with this kind of things? So let's consider now what is this personal care utility. So let's switch a little bit to the technical side, and let's start considering how we are going to deal with these technological issues. So, personal care utility. Now, when you start thinking about health and somebody watching over you all the time helping you, what are the ideas that come to your mind? The first thing that comes to you is what you all practice without any exception. Whenever there is a doubt or somebody is sick in your family, etc., what do? You go to Google. Now you do go to ChatGPT or Gemini or Claude, and you start asking questions to them because you don't know anything. The health is so complex, eh, that we have divided it into many specialties, and one specialty person doesn't know much about the other specialty. Yeah. So how are we going to understand anybody's health? So whenever there is a question, we go there. Unfortunately, there is a lot more misinformation and disinformation on internet in the forms of WhatsApp University and other social media than trusted information sources. Eh? But can we start looking at that problem and provide that information? So the first component is, how do we provide the right information at the right time in the right form? If I am a Hindi speaking person, I am most comfortable in Hindi. The information should be provided to me in Hindi. I should be able to converse with the system in that language. I can go down to the lower level and I say, if the system can provide me in Bundelkhandi, that will be better. Yeah? But that's what we require. And that information should be trusted information. So the first major component is, how do we build something like this? You know something very interesting? When internet started, and it started becoming popular in 1995, in 1997, there was a very strong application developed by the same person who developed Netscape, the first browser. The name of the system was WebMD. Yeah? And we will talk about WebMD in a second. Okay? But that was the thing that to provide information to people. WebMD exists even today. Many of you must be using WebMD. Okay? So that is the first thing. The second thing is, can we provide correct guidance to a person when the person is facing a problem? How can I do that? You guys all know how to use thousands of sensors, collect the information. You know exactly how the navigation system on this works. Anybody in this room who doesn't use the navigation system? Or you think that you can go to a new city and can you survive without a navigation system? Yeah. Navigation systems did wonders for us. GPS combined with complete knowledge of the city, including one-way streets, including point of interest, including everything, has done wonders for you. Now, if we can develop so powerful navigation system, why can't we develop personal health navigation system? Why can't we understand GPS for a person and use all the knowledge that is available in health sciences to pull it all together and make it useful for people? And keep on providing this information at every moment in time like a navigation system does. The next area that we need to worry about is, independent of all this, there is going to be a pandemic, there is going to be accident because of genetics and because of our carelessness or all kind of things. We are going to be sick. So we will have to go to doctors. But when we go to doctors, what becomes the biggest thing? Let me just share a 1 minute anecdote with you. Last 1 year, I went through two problems. Number one, my dog had a cancer. And number two, I had my heart valve removal. Yeah. In both cases, Doctors gave me all the information. I try to read it. Do I understand any of it? The answer is no. And if I don't understand who for the last 15 years has been spending all my time in healthcare, and trying to understand how these things happen, what about everybody else of normal, decent people? They will not understand anything. So I started using, like all of you, ChatGPT or Claude to share. Now, they have been trained to tell you that they are not doctors, so they will not give you any information. So I used a very simple trick. I took all the reports that I will get, fed it into those things, and I said, this is the report that I have. Now, please explain this to me so that when I'm interacting with the doctor, I can talk intelligently to the doctor and I can ask correct questions. Boy, it made my life so easy because it explained me everything that was going on much better than the doctor's report can do. And I was able to deal with the problem much easier. Why can't we do that kind of things here today? So, effectively, we can combine all these three things and say that personal care utility is combination of providing you health information, providing you health navigation, and providing you guidance and assistance when you are sick and you are interacting with doctors. And if you start putting together these things, then you start comparing the ICU architecture, intensive care unit architecture that we put or saw with the PCU architecture. Very interesting when you go through details of this, and in the interest of time, I'm not going to go through all the details there, but the most interesting thing is in ICU, everything is designed so that people like nurses and doctors are being given all the data, and they are the decision maker. In PCU, we are going to take all that data, feed it into our AI systems at the right time, at the right place, in the right form, and our AI systems are continuously going to monitor and start providing us all the helpful guidance. So this is what we start doing this. Once we do this, what we start saying is that when we go from avoiding diseases to achieving what we want to do, our goal becomes not just to, I have diabetes, I have a heart problem, I have this problem. Let's try to change the problem. Why do you want to live? What will make you feel that your life is good quality? What is it that you want to do with your life? Because that's what is the most important thing. What do you want to do with yourself? And if you start thinking about this, then you are going from fear-based approach to aspiration-based approach. In place of fear, you are saying, what do you want to do? And in place of, there is a very beautiful book written by Atul Gawande, where he argues that the healthcare focus, he himself is a doctor, surgeon at Harvard, so nobody can say that he doesn't know about these things. But he argues in that book that unfortunately the whole focus of healthcare industry is how to prolong your life. Not how to make quality of your life better. They are measured in terms of how much life, the best measure is in which country longevity is highest. So how can we change that focus to health span extension? And how can we do all this seamless integration to accomplish this? And this is what in this diagram we are trying to show, that in personal care utility, we are putting all these things together. So what do we want to do now is to look into the technical aspects and get into putting together some of these things in a form that we can see that some of these things work. And I have been a little bit biased in this part of the presentation. I'm talking more about what some of the points that have been addressed in my research lab. Okay, so this is what we want to do. This is what the repair paradigm was. When we talked about sick care and we put the repair paradigm, it was measure the data, estimate current health state, and then come up with the guidance. Let's add one more block to this. What is your goal? Why do you want to be healthy? Yeah. And if you put together that goal, it could be simply, I want to get rid of diabetes. That's all. That's perfectly fine goal. Okay. Then if I'm taking some action, how do I know that I'm improving? The famous feedback. The famous thing that our body uses 24/7 to keep us healthy. If that is the case, then the next thing is, in order to deal with this kind of concepts, I require each individual's model. Remember Oscar Wilde? He said every individual is different, and every individual is what makes important contributions. So if we have this, then now we have to put together these components. And when we start thinking about guidance, then you start thinking about what are the major lifestyle factors. Everybody has known, all the ancient medical systems till today's medical systems know that our life depends on our lifestyle decisions. Medicines when needed. Medicine should not be the primary. Hippocrates said long time ago that let food be thy medicine and medicine be your food. Yeah? So how can we start doing some of those things? That means we start considering that a person is really characterized by their genetics or different types of omics, their lifestyle, and where do they live, what kind of environment they are exposed to. Social determinants, climatic conditions, and all those kind of things. Okay? So you will again start recognizing that lifestyle and exposomes are pure service operated situations. Okay? So this is how the system works. You start combining all these blocks to combine this and model the person. And you create this model as you decide how you want to represent this model. Yeah. And this model can be prepared for short period, for long period, or for all your life. If you decide to put people in ICU from birth till death, then you start preparing the model of the person from that moment. Or if you are more concerned with the business of health, then you say that I want to reduce hospital readmissions. So you start modeling the person once the person leaves the hospital after their heart attack. Okay? So you decide what you want to do, but you start creating this kind of things. And when you start creating this, then question comes, how do we build a personal model? I'm sure most people in this room have been hearing and thinking of using something called digital twin. Okay. Digital twin is collect as much data about each machine, each city, each process, and use that. Let's change that slightly. Digital twin is very good for systems that do not have human beings as part of the system. As soon as you put human being in the part of the system, digital twins start presenting lots of difficulties. Yeah. Why? Because for human beings, the most important thing is this. You start by collecting all this data, but from this data, you remember, data is very good, but data is in fact, for most of us, useless. You don't really give a damn about data. What you care for data is insights which are actionable, which you can understand. We understand events and causality, but more than all these things, we understand stories. Yeah. And if we can put together these things in terms of stories, then system works very good. So can we take the good things from digital twin, modify it, and we started calling them personicals, personal chronicles. Okay? So take the data, analyze it into events, convert it into chronicles, and from chronicles, you can start doing the modeling, mathematical modeling, come up with the model that will be used by your mathematical systems, by services operations, or that can be used to tell the story to the user who will understand the story. Okay? So we start doing this kind of thing. That means if we start considering services, then we have these three very important aspects. We start considering that health is not visiting a doctor. Most of us visit a doctor no more than few times in a year. If you are lucky, you visit only once a year or less than that because you are healthy. Okay? So health doesn't happen in doctor's office. Health doesn't get measured in doctor's office. You live 24/7 all your life. It's only when you have some serious problem that you cannot handle with, that's when you go to doctors. So health is always happening. What you are interested in is effective care. This effective care can come to you when somebody is observing you, providing you quiet guidance when you require it, providing you quiet information when you require that. Okay? And this all can happen by putting together all these, starting from data collection mechanisms, which are nothing but IoTs, to all the mechanisms about distributing data, putting data in the correct form so that correct decisions can be made anywhere and can be distributed to people. And this was all this last few days you have been hearing about. So how do we do this? There's a very interesting thing that I call healthy AI triad that has been developing. The first aspect of this triad is how can we develop conversational multimodal systems using LLMs. And you heard about this in different, including a keynote talk yesterday. Okay? How do we start developing these systems? We'll talk about this. The second thing is, nowadays everybody has started talking about health agents. What are health agents or what are agents and how do we start using those? And third thing is, what kind of foundational models exist and what we will do. So with respect to the first thing, luckily we got into a situation where people from many different universities and government organizations started working together, and we put together a team to analyze something that we started calling foundation metrics for healthcare. Yeah. This paper was completed last year in July, published, and I am told that this was one of the top downloaded paper uh, from this journal. The whole idea was when we evaluate an LLM system, we start talking about hallucinations, how correct is the system, and how easy to use, and what is the effectiveness of the system. But in healthcare, there are some other aspects that start becoming very important. The two important aspects are what is the trustworthiness of the system, and the second thing is what is the level of empathy that the system can show. It has been argued many times by healthcare people that empathy is possibly the most important aspect in healthcare. You say that this particular doctor is very good, not because this doctor knows a lot, but because the doctor knows how to show his concern for you. And he is genuinely concerned about you. Yeah. So empathy plays extremely important role. So this is the one thing that we have to develop. Agents. Agents has been one of the most talked about topic in the last few years. Uh, in the simplest form, any AI system that you develop is start being called agent. But that's a poor definition. The good definition came from your friends at OpenAI, where they started saying that there are 5 levels of AI. As you see in this table there, the first level is basically how you develop chatbots. That everybody can do now. The second level is how do we start doing reasoning and some form of explanation and all these things. This is where you are seeing in last 1 year the maximum progress. The third level is how do we design agents that systems that can take actions. Now, actions doesn't mean transferring money from one place to other. Action means understanding the context, understanding that the system is working in himself, the agent itself is working in the real world. So the sensors, like in your navigation system, your car is being driven in the system. So the system knows the context, where you are going, what kind of information you have, where you are, and all this kind of thing. Now, can you have that kind of information for these agents? And then it goes further. But the important thing is, according to OpenAI, they are making progress in level 2. They haven't started touching level 3. But everybody is starting to talk about developing agents. Okay? So how can we go and start measuring context and all this kind of thing? That's when we start jumping into conversational health agents. How can we develop agents that can talk to you about health? Now, when I say talk to you about health, you as a patient, but you also as a doctor, you also as a nurse. Okay? Any health care stakeholder should be able to communicate with this. And that's when you start designing systems that start looking like this. Okay? Where you see that there are 3 major components in this: personalization, health agents, and health information. How do you bring trustworthy or trusted health information at all the times? LLM systems can do very good job for those things because they can read all the new publications, combine all that information, but they don't know all the information about you. So for that, something has to be done. Okay, so all that kind of thing had to be done. Health agents are going to be able to understand all the queries that are being done. They will also try to understand using RAGs, retrieval augmented queries, or generation there to start putting together this multimodal environment and starting to provide you correct answers there. And finally, how do you start doing this conversational aspects in whatever the correct language, where you are, in what mood you are, understanding your tone, understanding your facial expressions, and all these kind of things. Okay, so can we take the first step in that aspect? Uh, some very good students in our group put together this system that we started calling a platform. Once again, I will explain to you only at very high level without going into too much details about this. But look at this diagram. The lower level is purely the general purpose diagram. This is the system that you want to develop based on any of the LLM based systems. Take the system and start using this. But when you go to the upper level, on the right hand side, you have personal data and models. How do we bring all the data about the person? Because you are trying to treat a person. There are privacy concerns. They are having the correct data about the person. How do you share that data? In what form that data is shared? Completeness problems and all these kind of things there. But those things have to be put together. Then information retrieval. How do you use all this information and use your LLM-based system to pull the correct information in the correct context? Context start playing the most important role there. Okay, so you start doing that, and then finally, the other block is there are always researchers and companies coming up with new tools, new technologies for new types of data. New sensors are coming, you are developing new technologies for that. How do we start combining all these? How do we pull all these things together? So can we start providing an environment that will allow you to combine all these kind of things there? And we wanted to make this open environment. That's why we called Open SRA. Okay? Luckily for this platform became very successful. This is being used by multiple people to develop different types of applications. Uh, International Standards Organization, their healthcare or health informatics people have started using this to build architecture for personal health navigators. Okay? And they want to build this thing along with SL7 to build basically personalized health tools and standardize those things. But the most interesting validation for this application came last year when we had when there was a hackathon being organized by NVIDIA, Google, and Stanford University. And in that hackathon, about 200 students or 200 people participated. There were different types of tools available to them, but more than half of them used OpenSA to demonstrate that they can build applications. So this has been very interesting experience there. I will skip this privacy approaches and this because I don't have too much to add apart from the general thing. But I do want to start talking about how we develop some of these applications in the remaining part of this thing. So the first application is how do we provide this accessible, trusted health information when we need it? What does it mean to provide accessible and trusted information? This is exactly what you need. This should be very easy to get. If I am having any question, I should just take out my phone and say, hey, tell me this is what is happening. And the system should be able to tell me. It should be reliable. I should be guaranteed that it has up-to-date scientific information. It is not using the jargon that I don't understand, and it's unbiased. It is not funded by some particular pharmaceutical company, or more importantly, by some food company. Okay? So it is doing that. Believe me, I mentioned WebMD. WebMD started in 1997. It is even used today. But all the technology in WebMD, if you think about this, has extended only in the form of knowledge-based systems. How do they pulled in all the information? How do you interact with the system? How does the system know your context? How should it provide you all the information? How are they going to really update their knowledge base? None of this has been done. There is a wonderful opportunity if you want to build this. I can assure you that if you build a very good system, you will very soon become a very powerful person, very rich person. Okay? Do it. If you are really an entrepreneur in this group, try to replace WebMD by LLMMD. And you will be able to do something very interesting. Let's learn from your regular navigation system. And let's try to develop personal health navigation. What will personal health navigation do? It will guide you to better health. Better is defined by you. It has your model, it has your context, it has all the things there. It will use real-time information to redirect you around the disease. And it is like a navigation system. Whether you are a billionaire or you are a person living in a remote part in a poorest country, the navigation system is the same. Can we provide all these facilities there? And in order to do this, very simple architecture. This is really the implementation of that block diagram type architecture that I showed you. So we can very easily implement this and go forward with this. We can put all the goals. This is showing really the different components of the services where you collect all the data from IoTs, where is all your knowledge, where is the recommendation coming from, how things are being passed through, and so on. And you are making decisions about food, activity, stress, sleep, and medicine. Okay? So you start doing this. As I mentioned, ISO and SL7 are standardizing this architecture. And they have used that open SAR type architecture to modify this, where the whole idea there, and they haven't completed this, they are still working. As you know, that some of you may know, these standard things take several years. Okay? So they are working on this, going in this particular direction. Okay? Now this is the last interesting thing I want to share with you. Okay? This is one of the very interesting data that comes from World Health Organization. Okay? And look at this diagram. This is what is required to keep you healthy. 15%, when you look at this, 10% is the medicine, 20% is your genetics, 20% is your environment, and 50% is your lifestyle. Just think about this. If you think carefully, 50 and 20 environment, 70% is up to you. And genetics also, if you divide genetics into epigenetics, epigenetics is at least 5 to 10% controlled by your lifestyle and environment. So effectively you see that about 75% to 80% of your health is controlled by your lifestyle. But look at this, where we spend our money. We spend 88% on medicine and hospitals. Okay? And we spend single-digit percentage on thinking about your lifestyle or really your health. Okay? So, should we start thinking about our lifestyle, and should we start following what people in the old ancient medical systems like the Chinese medicine, Ayurveda, Unani medicine, and all those people have been talking about importance of lifestyle, and follow this and do something about it. Okay? So I like to say that should we start putting our money where our mouth is? Okay? That's the most important thing. Okay? Food recommendation. There's a very interesting thing. I see many faces in this room which are from different countries. Okay? Now just think about this. If you go to a nutritionist and you ask what you should be eating, to many people in this room, the nutritionist tells you should be eating broccoli, you should be eating spinach, and all these things. You should not be eating ghee, you should not be eating butter, you should not be eating salt and sugar and all this kind of thing. And you start following religiously your nutritionist. How many days will you survive? 2 days, 3 days? Yeah. After that, you will say, I want to live long. I don't want to feel that I am living long. Okay? So, in nutrition, the biggest problem has been that we consider only the nutritional aspects. We ignore the culinary aspects. For most of the human beings, culinary aspects are very important. How can we combine culinary aspect with these aspects? So this is what we start doing. Can we start developing a comprehensive food knowledge graph that brings all the information about different ingredients? How do you combine them? How do you process them, and what that does to the nutrition, what does that do to culinary aspect, and what is the final product, and it has that. That's one thing. The second thing is build a personalized food model. No two people have the same body. So what will affect my body is going to be very different than what will affect your body. How can we build a model? Now, 10 years ago, you could not do it. Today, you can do it because you have all the information about food things, but you can also understand uh, the lifestyle of a person better, and it's getting every day better and so on. So you can understand if this person eats this kind of food, that means this is what his tastes are. But how this gets affected by his biometrics, yeah, you will know that. Okay? So put together those things there. And then creating a detailed world food availability atlas. Where is what available? If you want to get some food and you happen to be here in Helsinki, you should not expect that you are going to get the same food as you get in Beijing or in Mumbai. Okay? So you have to start considering all those things, and then only you can start putting those things there. So this is what we want to do. If you want to create these three things, then you can do very good food recommendation engine. If you cannot do these things, then you cannot build a food recommendation engine. And that's what means this is what starts happening. We have the food knowledge graph, we have the food availability, and the personal food model. And that's what will give us. So, what I wanted to discuss with you is that how can we go from extending life to enhancing living? How can we go from ICU to PCU? ICU enhances, extends your life. I won't be here if it were not for ICUs. I have been in the ICU more than my fair share there. But I also understand the importance of PCU. And knowing the science aspects, I think time has come to start putting together this PCU there. The second thing is, how do we take all this data and turn it into care? That's what we have been trying to do in many other areas using different types of services. We spend so much time how we are going to do the edge computing, how do we are going to do the cloud computing, how they are going to interact, and all this kind of thing. PCU or health applications put much stronger challenge to us in terms of all the technical challenges, so that you will be able to write lot more papers and get your tenure and these things fast, or you can build unicorns faster. Okay, so this is what I wanted to say. The future of health is aspirational and data, aspirational health, and this is empowered by different types of services. Right now, I think the technology is here that we can start working on this. We are putting together these things. It's only us who have to make the decision how we want to develop, how do we want to do this. One thing that I heard over the last 3 days in this room uh, was about business models, that business models affect this and business model affect that. In my opinion, that's short-term perspective. The real long-term perspective is business models evolve based on what people want. We did not have internet-based models and any of these things. Now everything is based on that, and so on. So, thank you very much for all of this.